Stridor is an abnormal, high-pitched sound which is predominantly when the child breathes in, caused because of an obstruction in the upper airway or the laryngeal inlet. It typically sounds like this. It could be either congenital, that means from birth, or it could be acquired. The most common cause of stridor in a child around 6 months of age is by something called as laryngomalacia. This noisy breathing is associated with depression just below your neck called as suprasternal retraction, as well as a depression just below your chest bone called as subcostal retractions. The exact cause of this noisy breathing could be determined by direct visualization of the airway by something called as bronchoscopy. This is Dr. Kaustubh Moite, your pediatric pulmonologist, in episode number